Welcome back, guys. I am Jessica Davis here, SC Media Healthcare Editor. I'm here today with the incomparable and enigmatic Alissa Knight, partner with the Knight Group, one of many titles. It's good to see
I love that title. That was great. That introduction was amazeballs. Thank you.
Well, so isn't
It's
the
so
work that
like
you
four
do.
dimension, 4D kind of meeting with
I
you,
know,
and
it's
then
nice.
Boston, and
I
then that
I
was
know,
cool.
full circle. I
Full
appreciate
circle is
this.
great.
Yeah, I want to be, yeah. I mean, honestly, I feel like you're doing some of the most important work out there, just
Oh, thank
given
you.
how rapidly APIs are happening. I feel like somebody needs to
Do something about
be
it. It should be me.
patrolling it. But I mean, starting with that, I think it's pretty interesting. The work with Fire APIs, I think that was some of the most interesting feedback I've got. We'll just put it that way. And I think a good place to start is to make sure everybody knows sort of your work that you did there
Yeah.
and hacking into those Fire APIs and sort of, yeah, let's sort of get everyone up to
Yeah.
speed.
Okay. So let's define FHIR. Fast healthcare interoperability and resources. So I actually had no idea how to spell it when I walked into the research. So as with all of my very controversial research, it starts out with a client, and the client was an API security vendor, and they wanted to be able to prove how vulnerable APIs could be. And so the first round or phase one of research was me hacking into mobile health apps
Mm,
and APIs. This was around the time of COVID, so
mm,
2020 timeframe.
yeah.
And so much of our healthcare data and so many startups were raising a lot of venture
Mm,
capital that were mobile health apps and APIs. And so this would allow you to communicate with your doctor and all this other stuff. And then we said, well, let's do a phase two. That was fun. It's incredibly scary because I had hacked, what was it, 30 mobile health apps and APIs in less
yep.
than a week.
Yep.
And then I was like, I must do this again because I don't have enough people that hate me. So then we targeted Fire.
Mm,
And Fire is basically this type of API that healthcare payers and providers are being required, mandated by law,
mm,
to make our healthcare data available through these APIs. So it's the United States and really the world kind of getting together and saying patients should be able to access their own healthcare data. This whole, I go to one hospital and the other hospital doesn't have my health records. All that is going to be fixed with Fire.
mm,
Now, my concern was this is our healthcare data, right? It's worth 1,000 times more on the dark web than a US credit card number. So this is, something that if your healthcare data is compromised, I can't send you new healthcare data in the mail. With a credit card, obviously, it's easy to replace that. So the research started. I had no idea what I was walking into. Maybe before you wrote the story, you didn't realize either. Like it was, or you knew
I
that
did.
the storm was coming. So firestorm. Ooh, good. That's a good one
We haven't done
too.
that
The
one yet.
firestorm is coming. So I published the research. I was able to hack millions of patient records through these APIs, and through what are called intermediaries, who are basically collating all of our data from all these hospitals and all these records over Fire.
Mm,
And instead of hacking 1,000 hospitals, I just had to hack one of these sort of what would you call them? Just kind of people in the middle, right? And then I had access to all the patient records that they were pulling together. So it was very controversial.
yeah.
I published the report on Twitter, and the firestorm came, and
And it's funny because
I
it's
felt so bad for
interesting.
you too. By the way, I
I
want to say
know,
this. I
which
felt
was,
so bad
I
because
know.
everyone went after you for the story.
But that's the thing, though, and I think that when it comes to healthcare, and I've been doing this long enough where there have always been concerns for me where we're moving very, very fast. I mean, healthcare
Yeah.
is asked to do so much innovation, but
Hmm.
there's still a lot of really, really craggy foundation that sort of has always concerned me. So your report just sort of added on to that,
Yeah.
and I think it's important work just because we do need to find where those gaps are. Because if we don't know
Right.
where they are, like how on earth are we gonna,
Was-
right? Because you're not even suggesting that we stop this interoperability
I'm
push,
not.
right?
Yeah, yeah, and
Exactly,
and that's kind of
exactly.
and that's kind of the thing. It's like I was attacked for the imagery in the report, like it was too comic
Yeah.
booky, and it was just visual art. I got attacked for my gender identity. There was like personal attacks. It was crazy. But I think you're right. Like, healthcare issues affect everyone at a very
Right.
visceral level, right? It was a very visceral response from the FHIR community.
Hmm.
And you made a good point before we went on air that, the visceral response, the negative, the attacks that I received weren't from HL7.
Hmm.
They weren't from, politicians.
Right.
They were from people that have been involved in both sides of this fight, and they saw this FHIR report about the vulnerabilities in these FHIR implementations, and what my findings were. I think they took this as like, you just set us back 20 years.
Mm.
They took it personally, and they saw this as a weapon that I was using. They were concerned the EHR vendors would use it as
Mm.
is fodder to defend the reason why this shouldn't happen. EHRs were fighting against this effort, and probably, I think, still to this day, they're fighting against this effort because once that data leaves the hospital,
Mm.
once it leaves the healthcare payer provider, it no longer falls under HIPAA
Right.
and regulations. There's
Right.
no HIPAA requirements to secure that data once it leaves the provider.
Well, right. It reminds me a lot too of the medical device security situation where, we can't secure all medical devices in healthcare just because we
Yeah,
don't know what they are. But so for me, it feels like this is an important piece in fixing something that we knew wasn't perfect.
right.
And so without that data, we can't do that. So, but what I also find interesting, because I've read a lot of your other work where you're hacking into banking apps and
Yeah,
things like that, and it seems like it's not a fire problem. It's obviously an API issue,
agreed.
and
Completely.
so well, right. So how, without a standard in place, and I know that you're just a hacker, which I've heard you say, but you have some insight here where I feel like you must know some, or have a hopes for what we could do to better secure the APIs in general, right? I
Yeah,
mean,
so you're right. It's not a healthcare issue. It's not a banking issue. It's not a transportation issue. It's an everyone issue.
right.
And it is the implementation of the APIs. APIs are nothing more, for those of you who don't know what an API is, it's basically just the Rosetta Stone, if
Mm,
you will, that allows two applications to talk. And so the problem isn't the API or the sector. The problem is the code that's being written. The
right.
developers are writing. It's just like any other, unsecured or unhardened
Mm,
code. The only problem is that when you're hacking an API, you have access to all the data behind it.
mm,
So now, data is worth more than Bitcoin,
yeah.
right?
Yeah.
So it can be monetized, and that's why hackers are stealing it, ransoming it. It's because it's worth so much on the dark web, and it's worth so much to them. So we need to protect the data better,
Mm,
and we definitely need to now start with the APIs. I like to say, I start a lot of my conference presentations out with this quote from Anonymous, and that's, if I were to advise a hostile nation state on how to take down the United States,
mm,
I would tell them to start with the APIs first.
mm,
And that's because of how systemic APIs are across everything. That's the plumbing for pretty much our financial infrastructure, transportation, SCADA, industrial control
mm.
systems. It's the glue that's gluing everything together.
I mean, you work with a lot of different security vendors. I know that. And are you working with them to sort of lobby for some sort of API like push? Because I know in healthcare, like for example, there's a lot of work right now trying to fix the medical device situation because it is just as systemic because it's like the foundation of everything.
Yeah.
But are there, I don't know. I always wondered if there's like congressional hopes for like something, but it's so slow.
Here's the thing. I do want to say this. This was the most controversial research I've ever published, but it also was the most impactful.
Mm.
So once this published, I want to say the same day, the Office of the Inspector General reached out to me. So
Really?
OIG, Health and Human Services reached out to
Hmm.
me, said, "Listen, we've got your report. We're reading it. We have like teams of people reviewing." I was like, "Oh, this is cool."
Right.
I found out that two congressmen on Capitol Hill raised my report up during the congressional meetings, and talked about why this is the reason we need to
Mm.
do better.
Yeah.
So I feel like that, and then what ensued after with HL7 reaching out to
Mm,
me and saying, we want this to be an impetus for change
mm,
and on Capitol Hill around public policy. And then to find out later that this report actually helped shape public policy
mm,
around fire. That was, for me, a realization that it's vulnerability research like
mm.
this that actually does actually make change.
Well, right.
So yeah, I love that point because it's so important.
Because the thing too is, I will say for ONC, which is sort of the mitigating agent,
Yeah.
agency for the interoperability push, they have consistently updated stuff, and I think that stuff, the framework for sharing data,
Like
and I think that they're
stuff is
but
good.
they're based on like feedback and
Yeah.
reports and what they're hearing. I did want to ask too about the HL7. I know that you're still working with them. You have Fire Days coming up, and
Yeah, tomorrow morning I'm keynoting at Fire Days,
how
Dev Days,
exciting.
yeah.
I'm wondering though, but are there any updates on that? I know you've been working with them and trying to help sort of
Yeah. So
soften the
they're,
process.
I want to give shout outs and respect to HL7. I mean, they really they haven't been adversarial at all in what followed after the report.
Yeah.
They've been very collaborative, wanting to bring me into the HL7 security working
Yeah.
group meetings. John is Murky, as you know, Robert
Yeah.
Graham, the
Yeah. Yeah.
the founder of Fire, creator of Fire. But they've been awesome. A lot has happened since then. I'm speaking at the conference. I helped write this letter
Mm,
that went to Congress, that went to the Senate, to help change things. So the work continues. As you
yeah.
mentioned, not everything happens overnight with government
Or healthcare.
or healthcare. But for me, we have to start somewhere, right? How do
Yeah.
you move a mountain? You move it one rock at a time.
Yeah.
And so for me, this is very important work, and I'm glad that something that I did is actually helping to contribute to that change.
No, for sure. I genuinely appreciate it because I feel like, well, it's interesting because I feel like your report like confirmed what privacy advocates have been saying for the last few years, which is where's the API standard? Where's
Yeah,
the API standard? And we're still pushing down because it is really important to have that access. But again, such important work because again, how are we going to secure something if we don't even know where the issues are,
yeah. What are the
And
problems? What are
yeah.
the vulnerabilities? Because and that's what I love about the research that I do. What I like to call adversarial research,
Mm,
or adversarial content. So you typically always see content from the eyes of the defender, from
yeah.
the eyes of the blue team. You never really see content from the eyes of the adversary.
Mm,
And as a recovering hacker of 22 years, I've been able to merge now film production, and the movies that we make, with this adversarial content, and shed light onto these problems
yeah.
and bring attention to these problems. Because it's one thing to go on Twitter and say, we have a problem here, we have a problem here, and
Right.
not provide any empirical data to back it up.
Yeah.
And that's what I'm doing with my research and with my content and the films and all the things we're doing is we're proving it through empirical data and
Right.
saying we do have a problem here. Here's proof of it. It's not to point fingers
Right.
and blame anyone, but it's to prove that there is a real, clear and present danger here. Sometimes, it's kind of like that whole, the Titanic and the big ice thing. Um,
Yeah.
it's what lies beneath the water that you can't see that's the real threat.
Are you hacking something else?
Yeah, I'm always hacking something else. I've, believe it or not, have begun to move on to unmanned aerial vehicles. So I'm doing a lot
Okay.
of stuff with UAVs. The my I think my API hacking research will always continue. As you know, I'm a filmmaker now,
Yeah.
and I'm doing a lot with Night Series, where our new can I just drop this? Our new film is
Sure.
premiering at AMC. Someone's gonna cut off like, no, don't say that. We've lost our connection. But our new film is premiering at AMC movie theaters tomorrow, and so we're excited about that, and also selected by Cannes Independent Film Festival. And so it's cool that these pervasive issues and these problems are actually going to Main
Yeah.
Street. They're going to, places like AMC movie theaters, where I grew up as a child. To see my film airing at AMC is huge,
Yeah.
and so you're bringing these very arcane, very technical things and issues to Main Street where a lot of people typically wouldn't understand it.
Yeah, it is funny because I think that we're in the industry. I think that most people don't know how pervasive it is. And I think that
Right.
it's work like yours that really sort of
Thank
gets us
you.
moving. Because I mean, again, if we don't know it's there,
Yeah.
what's obvious to us may not be obvious to others. So,
Yeah, and
yeah.
it is. I feel like it was a gut reaction by the community, by the
Yeah.
fire community,
Yeah.
and what happened. And for those of you who don't know, there was just a lot of drama that came out on Twitter and against you and the stories. I loved your stories. I think you did such an amazing. You're a brilliant writer,
Thank
Jessica, and so I feel like that was their initial gut
you. Yeah.
reaction, right?
Right.
And so we're always the initial gut reaction before we think is always going to be very visceral and
Yeah.
very emotional. But I feel like once everyone started to calm down and, Graham got involved
Yeah.
and John got involved and said, hey, look, no, we need to pay attention to this
Yeah.
is a real problem.
Yeah.
It almost like sort of just got everyone to take a breath and
Yeah.
take a step back and look at it through a different lens
Yeah.
that like yeah, wait, maybe she's not out to get anyone. Maybe a lot of this, the things that people were saying hadn't even read the paper. Like a
Mm.
lot of the people admitted, and I don't know if you saw those comments, but a lot of people admitted that when they went on the attack with you, with the article, and with me, they hadn't even read the paper
Yeah.
yet.
Yeah.
And so it's like, how can you comment on something when you haven't even read it? And
True.
I feel like that's a pervasive issue in our culture is that we'll hear it's hearsay like,
True.
oh, Jessica told me that this is an attack on
Yeah.
me and something I've been working hard on, and this person should be a villain and we should villainize her.
Yeah.
And then you ask them, wait, did you actually read it?
Yeah.
And I'm sure we
That's
can
so
all think of something that happened
true.
recently where something should have been read, but people were out there, campaigning against it.
Yeah.
But, and so I think once the emotions started to lower and everyone started to lower their
Yeah.
guns, they realized like this is a good thing because it's
Yeah.
everyone's. It's not a them problem. It's an
Right.
all of us problem.
Right. It's your data. Exactly.
So
But yeah, thanks for coming today.
yeah,
Thanks for
I'm
staying with us,
excited.
guys, and have a good one.
Thank you, Jessica.
All right.
Thanks, everyone.